in general, cannabis, anything, you should try to be on like the least amount of medication for the shortest duration possible. That should always be your goal. Now, I don't want to take that so far though that you take away medicines that would greatly enhance and benefit your life, right? Like if something's working for you, tremendously well, you may not want to eliminate that. And if you do it, you definitely want to do it, slowly overall. So I think it's careful. We need to be careful not to get, too far away from being afraid of being able to use the medicine. Yeah. So some people, who have really severe PTSD, they may need to stay on it longer, or some people, they may need the THC at first, but then they don't necessarily need it anymore, but they might still need their CBD. So it does vary, quite a bit. And it really just depends upon the person.
Welcome to Your Story Doesn't End Here, the mental health podcast of military and veterans who refuse to be silenced. I'm your host, Rachel, and my mission with this podcast is to be a voice for those who don't have a voice, bring awareness to mental health issues, provide value and solutions, and to change the culture when it comes to mental health within the DoD organizations. Hey everyone, and thank you so much for coming back for another episode of Your Story Doesn't End Here. Today, our guest is Dr. Mike Hart. He is a passionate advocate for integrating holistic wellness approaches into healthcare. He has a decade of practice in cannabis medicine and is currently the COO of Optimind Pharma, a publicly traded company which focuses on psychedelic treatments. Furthermore, he has an academic background in nutrition and a lifelong dedication to fitness and wellness, which he integrates into his personal practice and his daily life. Thank you so much for being on the show today, Dr. Hart.
Thank you so much for having me, Rachel. Super pumped to be here.
Yeah, so I'd love to just start with laying down some background about where you came from and how you got to where you are today and what you're doing.
Awesome. So I'm from St. John's, Newfoundland. So if you know where that is, awesome. A lot of people don't know where that is. So that's where I grew up, did my degree in nutrition there. Then I went to medical school. So I did 2 years in Saba and then 2 years back in Canada, mostly through Dalhousie and Memorial. And then I did my residency where I'm living now in London, Ontario at Western University, and then just kind of stayed around in this area. So I'm a family doctor, that's what I did my residency in. But about a year after or so I got out of my residency, I started looking at cannabis. And so right away, I had a lot of patients who were very, very interested, and then came up that, a lot of veterans were really looking for a doctor who would help them prescribe cannabis, because they said that, they were getting a lot of relief from their symptoms, their PTSD symptoms and also chronic pain as well, but particularly with their PTSD symptoms with cannabis use. So I really got into cannabis. That's been a big focus of mine over the last 10 years. And I still work at, 2 other walk-in clinics too. So I do a lot of, just general practitioner stuff, like sore backs, sore throats, coughs and colds, all that kind of stuff as well. And then I'm also into, psychedelic medicines. So I do prescribe ketamine, which we can chat about today as well. So ketamine technically is actually not a psychedelic. It's actually an anesthetic, but kind of gets grouped into those medicines because it does produce, this, disorientation and also tremendous mental health benefits. So I can understand why people may group it into that category, but technically it's not. And so that's kind of, full circle of where I am now. So I'm still doing cannabis medicine, still doing a lot of ketamine medicine, and I still do, general practitioner work at the walk-ins and stuff. And I guess one thing I should have mentioned, particularly for your audience, Rachel, is that I did write a book, co-authored a book 2017. It's on Amazon, Why Vets Are Lighting Up and Ditching Pills. And so the reason why I wrote that book is because a lot of veterans, again, have told me, and I've seen it firsthand, that they're getting a lot of relief with cannabis use. So that's a little bit about myself. If there's anything more you want me to share, I can certainly do that.
Awesome. I appreciate that. And so you obviously got into the world of cannabis and psychedelics. It sounds like before it was as mainstream popular as it is today. We hear a lot more about cannabis, especially today, now that has become legalized in more areas, right? But 10 years ago, that wasn't necessarily the case. So what made you decide to start exploring that avenue of medicine?
Sure. Well, I mean, I had used pot before, myself. And so I knew, it could be effective for people. And never used it like I used a little bit recreationally with my friends when I was younger, like mostly on like the weekends and that kind of thing. But I was never like a pothead per se, just kind of more like a weekend user with my friends. And so, but I understood that, it's very, very good for sleep. So I had used it, a couple times for sleep when I was a resident, when I was having trouble sleeping. And so, when my patients started asking me about insomnia, and I was, prescribing them, whether it was trazodone or zopiclone, kind of the more, common medicines that you would prescribe, I always kind of thought in my back of my head, like, man, I wish I could just, maybe offer them like to smoke a bit of pot too, and not necessarily smoke it. Like there's obviously ways where you can vaporize it or you can eat it, which, can be better for you. And so because of that, I felt like I kind of was like, compelled, like I knew I experienced it personally that like, this can be effective for helping people sleep. And so in 2014, and I only started practicing in 2014, Canada introduced this new system where it was kind of easier for physicians to prescribe cannabis. And so I jumped on that right away. And then, initially I wasn't necessarily like seeing a ton of vets, the ones I did see some that came to me, but I would see people for, like little babies that had seizures or just people that had, anxiety disorders. And this was also too, just when CBD was coming on the scene, and CBD is incredible. We can certainly talk about that. And so, a lot of my patients were getting tremendous benefit, like right away, as soon as I got into this program, and I could, prescribe it fairly easily. And so because they were getting, benefit, I think, the word just got out that, what, cannabis, is an effective medicine for, a lot of different things, but particularly for sleep. And so, the ball just kind of kept rolling.
So let's talk a little bit about the negative things that come up when we talk about psychedelic medicine or even cannabis, because I think that's the number one concern when we talk about, especially a military affiliation, is a lot
Yeah.
of people have concerns. Now, there's obviously negatives to the trazodones and, all the mental health medications that are prescribed as well that aren't necessarily talked about. There's a pamphlet that's kind of passed off and here you go, read this. And the questions aren't really answered, but I think it's important to address these things because it maybe would help destigmatize it a little bit. Because then we can now talk about the positive side after. But I want to start with talking about what maybe some of the negative side effects would be, and maybe who wouldn't be a recommended, patient to use this type of medication. But I'll let you expound more on that because you know a lot more about it than I do. But what are some of the negative things that come up when we talk about cannabis and psychedelic medicine?
So for this discussion, I mean, it's mostly just going to be like THC because THC is what, really has the negative effects.
Right.
CBD, I'm not saying has zero, but, it's mostly the THC that really scares people. So, the biggest thing with THC, and people probably can almost guess what I'm going to say, is that, it can potentially induce, schizophrenia or cause someone to have a psychotic episode. So, if you do have a strong family history of like bipolar, schizophrenia, any of that kind of stuff, I would really kind of just stay away from THC. I mean, there may be, a way where you could, introduce CBD to a very high dose, and then you could say, maybe 4-to-1 CBD to THC, and then, maybe to get to 3-to-1 to 2-to-1. But, even then it's a little bit wary. So I would, if you're, have a strong family history again of mental illness, particularly with bipolar or schizophrenia, I would probably try to stay away from high doses of THC. The other thing with THC too is that, people don't like talking about this, but you absolutely can develop a tolerance to it. And I can share with you, my approach about how to not develop a tolerance to it as well. But, if you are using what I called, unopposed THC, basically just means THC without any CBD, and you keep on using it over and over, eventually you will develop a tolerance. And then you're going to be getting to a point where you're not using the cannabis to treat your symptoms. You're just using it so that you don't get the withdrawal effects anymore. And so you really don't want to get into that category, because like I said, you want to be able to treat your symptoms with these medicines. You don't want to be using these medicines to, effectively treat withdrawal symptoms. And some people will laugh when I say withdrawal symptoms from cannabis, but you absolutely, like, talk to anyone who uses high THC all the time and then tell them to go a day or two without using THC and see what happens. Right. So there's definitely some, like, pretty heavy withdrawal effects there. So, those can kind of be the biggest ones. Like, you could also say, some people say, oh, if you smoke pot, it makes you lazy and that kind of thing. I don't really buy into that as much. I think that's more of like a personal choice, and you could get lazy with just watching TV all day. You could get lazy with, a million different things. And so, I don't necessarily think that like pot is necessarily responsible for that in those instances. What I'm saying is that that person would have been like that anyway. Right. And so I don't buy that too much. And then some people think that, it can cause weight gain. And this is a really kind of strange one, but if you look at all of the data, literally like all of it, cannabis users always have a lower BMI on average than non-cannabis users. Now, some people may say there's a little bit of a healthy user bias there as well. Like, people who use cannabis may be in some ways, a little bit more thoughtful about what they put into the body than the non-cannabis users. But considering how many people use cannabis, it's kind of hard to believe that argument. So there are some kind of hypothetical underlying mechanisms why they believe why that may be why that may be true, but hard to really know, for sure why. But those would be some of the bigger kind of negatives. I'm not saying that that's all of them, right, but those would be the bigger ones. And obviously, even if you don't have schizophrenia or a family history of schizophrenia, that you can get paranoid, you can hallucinate, particularly if you're using high dose edibles. That can give people a really bad time. You can just have like a bad trip per se, right? So you want to be really careful with how you're using cannabis, particularly with high THC, because it does have some negatives.
So how heavily monitored is when someone comes in for a prescription cannabis or even psychedelic usage? It sounds like you are recommending like a certain amount of THC in certain ways that your patients can not become dependent or immune to the effects of this medicine. So how heavily are you monitoring these patients and their intake?
So, I have a pretty basic approach for new people. Like, say, if you're a veteran, or even if you're not a veteran, you have PTSD or chronic pain. I should mention chronic pain too, because a lot of people do use it for that. And as you know better than I do, a lot of people who have PTSD also have chronic pain. So, when people come into my office and I want to be able to treat them, but I don't want them to get dependent on THC, this is my approach. So first of all, in the daytime, no THC. That's my goal with all my patients. In the daytime, no THC. So just high CBD oil. Obviously there's, some patients who have like really, really severe back pain, neurological issues, and that kind of thing. And unfortunately, they may need a little bit of THC to help them get them through their day. It's either that or opioids for some people. And I think that cannabis has been shown. I think most people would agree that they're much safer than opioids overall. And so, if you can, just try to use CBD in the daytime, and I'll explain why a little bit further. And just on that note too, this is a good segue to talk a little bit about how CBD can actually decrease learned fear. And essentially, that is what PTSD is. It's learned fear, because like a lot of my vet patients, one of the big questions I ask them is, who gets the groceries in your house? And it's always, I have a lot of trouble with it and that kind of thing. And, obviously that's a learned experience. Like, no one's born afraid to go to the grocery store, but through trauma, through life experiences, we develop these things that we become fearful of, and things that we shouldn't become fearful of. And so CBD can help decrease that. So again, moving on from the daytime to the nighttime. In the nighttime, I'll offer patients to just use CBD, and probably about 15%, maybe 20% of my patients can get away with just using CBD at nighttime. So again, that's close to like 1 out of 5 people, which is pretty significant. But for a lot of people, they do need the THC, because the THC is what really helps get rid of the nightmares. And then also too, like I said, a lot of the patients that have PTSD also have chronic pain, and THC can be pretty effective for treating chronic pain. So in the nighttime, what I get them to do is use a blend of CBD and THC. And the reason why I want people to use a blend as opposed to just pure THC is, like I said earlier, if you do use, again, what I call unopposed THC or THC without the use of CBD, you can develop a tolerance to it. But I find that when my patients use a blend, they don't develop a tolerance. Now, I'm not saying that within the first few months you may not need to increase your dose, because you need to fool around with it until you find that perfect therapeutic dose for yourself. But in the first 3 months, once you get past that, and once you find a dose, I find that with the patients that use CBD and THC, they almost consistently can use the same dose for years and years. Whereas when you get into higher doses of THC, they kind of just go all over the place.
So is this something that patients have to use for the rest of their lives, or do you have a demographic of patients that learn the skills or mechanisms to cope with, or I don't want to use the word cure necessarily, but no longer feel the need to use any kind of substance to help them live their day-to-day lives?
Well, 100%. So, in general, cannabis, anything, you should try to be on like the least amount of medication for the shortest duration possible. That should always be your goal. Now, I don't want to take that so far though that you take away medicines that would greatly enhance and benefit your life, right? Like if something's working for you, tremendously well, you may not want to eliminate that. And if you do it, you definitely want to do it, slowly overall. So I think it's careful. We need to be careful not to get, too far away from being afraid of being able to use the medicine. But coming back to your question, yeah. So some people, who have really severe PTSD, they may need to stay on it longer, or some people, they may need the THC at first, but then they don't necessarily need it anymore, but they might still need their CBD. So it does vary, quite a bit. And it really just depends upon the person. But in general, the worse the injury, the worse the PTSD or the chronic pain, the longer they have to be on it. And, PTSD is something that is very, very difficult to overcome, but people do overcome it all the time. Like it does happen. With chronic pain, yes, some chronic pain can get better, but some chronic pain, just doesn't,
Right.
there becomes a limit. And so for those patients, they may need to take it for the rest of their life, unfortunately. But
Right.
regarding the mental health aspect, I mean, you can certainly, reduce your use of THC and even reduce your use of CBD over time.
That's incredible. Because I know with a lot of the pill form medication that a lot of doctors prescribe, a lot of people are dependent on that for the rest of their lives. And a lot of times, in my experience, especially using, SSRI, I found it to be less effective after time. And that can be, from a patient perspective, it can be very frustrating to feel like I'm out of options. Now, I want to talk a little bit on the active duty side. I know that a huge debate and argument when it comes to especially cannabis usage with active duty military is the cognitive effects. And, so I know when we talk about things that are legal here in the US, especially, alcohol is legal, cigarettes are legal. Obviously, they have cognitive effects as well. What is for someone that is following your protocol and using CBD during the day, THC in the evening time, what is the span of the cognitive effects? How long does that last? If, say, someone takes THC, CBD blend at nighttime before going to bed and they have to wake up for work in the morning, how long is that affecting them cognitively to where it may potentially negatively impact their ability to make sound decisions?
Yeah, so that's a very good question. So what I will say is that first of all, it's completely dose dependent. So, the more of that blend you take at night, yes, the better you'll probably sleep, but also to the higher chance you are of being groggier in the morning. So, the dose is very, very important there. In terms of the half-life with CBD and THC, it kind of varies in the literature, but it's usually somewhere between 4 to 8 hours, let's say like 5 to 6 to kind of be safe. And so generally speaking, when people wake up in the morning, most of it is gone. Now, some people will say that, they feel a little bit groggy in the morning when they take it. Now, some people also just feel kind of groggy in the morning almost every day anyways.
Yeah.
Even the best of us, like I've even heard like Andrew Huberman say that kind of stuff before,
Right.
So some of it is kind of, and is difficult to say, but a lot of people will say that like once they get up and have their coffee in the morning and they get going, everything is fine. But in terms of the cognitive impairment, I think that's pretty limited if you're using a blend and if you're keeping your THC, say under 30 to 20 milligrams, like in that range, you'll probably have pretty minimal cognitive deficit. If you're using beyond that dose, I could potentially see maybe some mid-morning, to even afternoon. I mean, it also depends upon the person, so, you have to know yourself, whether or not, how you feel cognitively is like how you feel cognitively at your best. Like you should know that. And
Right.
so just as like a feeling. So, if you know that and then you take the medicine and then the next day you don't feel as good, then, obviously you need to back off on your dose, and you may not need to eliminate it, but you probably will need to at least back off on your dose.
So it sounds like just any other type of medication and starting a new medication protocol, because not an unfamiliar thing to the world of medicine to try something new and understanding that it might have side effects that
Yeah. I
has
mean,
to be
I,
adjusted.
I would say like, if you're looking at under 30 milligrams of THC with a blend of CBD, I mean, the grogginess that comes with that in the morning. And again, I'm sort of, there hasn't been a study done on this or anything, but I could imagine that it's not going to be any more than what you would get from, say, a medium dose of Zopiclone or Trazodone or any of the other commonly prescribed sleep medications.
Okay. So speaking of studies, what are some of the long-term study results that have come from usage of cannabis or psychedelic medicine?
So, I mean, long-term studies, unfortunately, don't really exist because, we just kind of started prescribing these medicines. So, I'm not really even aware of too many studies that are, beyond like a year kind of thing. So I can't really give you a great answer on that question so far. But what I can say is that, if you do use cannabis responsibly, like especially, when I say responsibly, I mean by, not using high THC all the time, then I think your chances of having any long-term cognitive deficits are going to be very, very minimal. And, there's even a lot of evidence indicating that CBD can actually be effective for reducing cognitive impairment. So overall, that's not, I don't want to say it's not a great concern of mine, but I don't feel like it's gonna that the research is gonna eventually show that this is really producing massive declines in cognition overall.
So as we have come into this world where CBD has become more of a mainstream thing, I mean, you can basically go anywhere on the internet and get CBD, right? What is your recommendation for people that maybe want to start implementing CBD or CBD THC blends into their day-to-day regimen as far as quality and figuring out what's going to be the best product or a better product for them?
Okay, well, I know I'm probably going to get some hate for this, but I am a doctor, so I do think you should talk to your doctor about it because it is a medical condition. If you're trying to use CBD, you're probably trying to treat anxiety, you're probably trying to treat pain, you're probably trying to treat something, right? So I think you should go chat with your physician about it first and see what all the options are, and to make sure that CBD is in fact the best option for you. And then once you generally speaking, anyway, in Canada, if you see a physician, then you have access to the MMPR program, we call it here. And then, you can then access, all of the regulated products, which are, free of, pesticides and all that kind of stuff. And then, then that what's on the label is actually what's in the bottle. So, those are the main things that you want to do is you want to go to your doctor, and then you want to make sure that what's on the label is in the bottle. So, make sure that it's, regulated to some degree, because if you go in, I don't know, all about the America's systems, but I don't know, if all these dispensaries, if the products in them, if they have what's actually contained in them is on the label. And so I'd be kind of wary of that. And I'm not sure how the best system to make sure that you do that is, but that would be my recommendation, is to find out how you can know for sure that that the product that you're getting has what it says is contained within it.
Yeah, I think it really depends on the state. I mean, I'm in Washington state where it is legal here. So there's a lot more information here compared to a state where maybe THC is illegal. But I know that a lot of places you can just go buy CBD at like a gas station or a grocery store. And I personally wouldn't trust that product, but I'm not saying that they're necessarily bad. It's just, it's hard to know when there's so much out there on the internet, or you can easily access something. And I don't unfortunately know the standards. I don't think it's regulated at all. So I think it is really hard to know, but that's really good advice. Now, if someone maybe couldn't go to their doctor, say they live in a place where THC is not legal, but CBD is, and they just have questions. And I know, just being fully transparent here, there's quite a few doctors out there that bring their personal biases into their practice as much as
For
they
sure.
shouldn't. Is there information that you have out there that people could research or get their questions answered? Or is there an avenue where you would recommend that someone go just to do their own personal research if they can't get the answers from their doctor, just to learn more about it?
Yeah, definitely. So, when I was on, and I made a video about this. So when I was on Joe Rogan about 4.5 years ago now, talking about cannabis, what I did was I went to a website called examine.com, and I use this website for not just for cannabis, but for a ton of like nutritional information, supplements. There's lots of great stuff there. So they will give you like basically anything that you want to know about cannabis is on that particular website. So it's examine.com. And then they have one page that's actually dedicated. When I say page, I mean, it's probably a couple hundred pages there, but they have one tab that's just for CBD, and then another one that's for marijuana, where they kind of talk about THC and blends of CBD and THC. So that would probably be the best place to go to. That's where I went to, and that's how I prepared for Joe Rogan. As I just read that, I printed out everything from that website and made it into booklets, and then I basically just studied that for a few weeks. So that'd be the best place to go to.
Awesome. Well, I'll make sure to put that in the show notes for anyone that wants to check that out. And thank you so much for sharing that resource. Where can the listeners find you? What are you working on? I know you mentioned that you have the book out there. That's an incredible resource. I'm really excited to grab a copy myself. But what else are you working on, and where can the listeners find you?
Sure. So, I'm right now, like I said, like I'm still, working at 3 different clinics overall. So I'm pretty busy, but I have my own podcast. I actually had a military member on there today, like we were talking about before the show, Andrew G. Huff, who's kind of been making some waves with Robert Kennedy recently. And then I'm on Twitter, and I'm also on Facebook and Instagram. It's all at Dr. Mike Hart.
Twitter X is what it's called now, right?
Oh yeah, it's called
Yeah.
X now. Yeah, yeah.
Yeah. Awesome.
It's
Well,
gonna take me a while to switch that up, I think.
yeah, I never was a Twitter person. I downloaded Threads, and I'm still not huge into it, but
Yeah.
uh social media is wild. So I'll make sure to
Social
post
media as
all
well.
those links for anyone that wants to connect with you and check out what you're doing. But thank you so much for taking the time to come on here and answer some questions. I learned a lot myself, and I think that when it comes to these still somewhat taboo topics in society, people have questions that they want to ask, but maybe they just aren't comfortable asking them. So thank you so much for being that voice for people that need questions answered and don't quite know what avenue to go to. I'm going to leave you off today with our last question, which is if you have any advice or any last words that you want to leave the audience with today.
Sure. Well, appreciate, you giving me this opportunity. And, what I will say is that, if you are interested in cannabis, like I said, don't go down the like high THC all the time route. I think that's, going to lead to like poor results overall. Like, yes, I bet you'll feel amazing, initially, and that might even last for, a few months, but eventually, it is going to wear off. And so, I think that's, probably the biggest message that I have for people out there is that, particularly for veterans who are looking to use cannabis, is that don't go down the high THC route and just use it all the time, because eventually it is going to backfire.
Thank you for taking the time to listen in today. With your support, we are able to increase awareness of the mental health issues affecting service members and veterans today, with the goal of creating positive change. If you got value from this episode, please take 30 seconds to subscribe and share this episode within your own network. Until next time, remember, your story matters, your mental health matters, and your story doesn't end here.